Your patient is screaming, not whimpering, not crying, screaming. The way people only scream when the pain becomes larger than the person. You do not stop. You cannot stop. Because if you stop, he dies. Right here, on this table, in this room that smells of blood and burning wax. And every person standing around you, the students, the colleagues, the observers, will watch you kill him with your hesitation. It is 1846. Anesthesia does not exist. The only painkiller you can offer is speed. You are holding a scalpel, and you are the best surgeon in the world. That is not a compliment. That is a sentence, because that is exactly why you are here. That is why this man is on your table. That is why every pair of eyes in this room is fixed on you, and not one of them is looking at you with sympathy. They are looking at you with expectation. Stay with me.
Because what happens in the next 15 minutes will change the way you think about pain, about skill, and about the price a person pays for saving others. First, you need to understand the world you live in, not abstractly, concretely. You are a surgeon in the middle of the 19th century. That means every person who lies down on your table knows with absolute certainty that it is going to hurt. Not a little, not tolerably. Enough to make grown men lose consciousness mid-operation. And that is considered fortunate. The ones who do not lose consciousness remember everything for the rest of their lives. Your predecessors solved this problem in different ways. Alcohol. Give the patient as much as they can bear. Opium, if it was available and if you knew the dose. A blow to the head. Literally, some surgeons practiced brief concussion as a mercy. Hypnosis. A few enthusiasts tried with mixed results. None of it worked well enough.
And so the primary instrument of the surgeon was not the scalpel, it was speed. Robert Liston, your contemporary, perhaps your idol, could amputate a leg in 28 seconds. From the first cut to the final stitch, 28 seconds. People came to watch him the way they came to watch a performance. He was famous. They called him the fastest knife in London. That was not a metaphor. That was the only form of mercy medicine could offer. You understood this from your very first day of practice. Speed is not skill for its own sake. Speed is ethics. Every extra second on the table is a second of pain you could have prevented. So you practice, every day, on cadavers, because that is how surgeons learn in your time. Anatomical theaters, bodies extracted from graves for money, students standing in rows taking notes. You make the same incision hundreds of times, thousands of times, until your hands stop thinking, until movement becomes reflex.
Until you can close your eyes and still know exactly where the blade is going. That is what it means to be the best. And that is why this morning, when they brought this man in, broken leg, bone through skin, infection already spreading, everyone looked at you. Not because you want this, because you are the only one with a chance. You were not born a surgeon, you became one, through years that most people would not have survived. In your time, medical education looks like this. You pay an experienced surgeon for the right to observe him, not to assist, just to watch. You stand in the corner of the anatomical theater and study every movement, every incision, every decision, until you have memorized all of it. Then come the cadavers. Hospitals pay for bodies. Grave robbers work at night. No one asks questions. 19th century medicine is built on a foundation that no one wants to discuss out loud. You dissect, for hours, for days. You learn anatomy not from books, but with your hands. You know where every nerve runs, every vessel, every layer of tissue. Not because you read about it, because your fingers remember it. Your first real operation comes without warning. Your teacher turns to you in the middle of a procedure and says, "Continue." Not because he is tired, because he sees you are ready, or ready enough. In 19th century surgery, the line between those two things is not always clear. Your hands shake for the first 10 seconds, then they stop. That is the moment you will remember for the rest of your life. Not because the operation went perfectly, but because that is when you knew you can do this. Something shifts inside you. The fear does not disappear, but it stops controlling your hands. Years pass. You become faster, more precise, more certain. Your reputation grows, first within the hospital, then across the city, then beyond it. Patients are brought from great distances.
Colleagues ask your advice. Students want to learn specifically from you. You have reached what you wanted. And only now do you begin to understand what that actually means. It means the hardest cases are yours. Always. The ones others refuse. The ones where the odds are minimal. The ones where the family stands in the corridor looking at the operating room door with an expression you have learned to recognize at a glance. Hope mixed with terror. And you walk through that door. Every time. Because there is no one else. Back to this room. The patient on the table. A middle-aged man. His leg broke badly enough that bone has been exposed for 3 days. 3 days is too long. You can see the signs of infection. The smell that you have learned to recognize and that has never once stopped meaning the same thing. Amputation. The only option. You explain this to the patient. He nods. He already knows. He has seen enough to understand. Either the leg or the life. He chooses the life. He is strapped to the table, not because he is resisting, because when the pain begins, the body will move on its own, without permission from the mind. A surgeon cannot work on a moving patient, so straps. A leather bite guard so he does not sever his tongue. 4 assistants to hold him down. You pick up the scalpel, the first cut, fast, deep, certain. There is no point in hesitant movements. A hesitant cut is pain without result. Better 1 precise stroke than 3 cautious ones. He screams. You continue. Your mind in this moment works like a mechanism. Not because you do not care, because you have learned to separate. There is the task, and there is everything else. Everything else can wait. The task cannot. Layers of tissue, muscle. You move quickly but not chaotically. Every motion is familiar, practiced, exact. The bone saw. Short, certain strokes. The sound you will never grow used to, but which stopped stopping you many years ago. 30 seconds. 40.
The leg is removed. An assistant takes it immediately. You are already working on the stump. Vessels, ligature, stopping the blood. This is the most important part. The patient can survive the amputation. The patient will not survive blood loss if you do not move fast enough. You move fast enough. 2 minutes and 14 seconds from the first cut to the final stitch. The patient is unconscious. He lost consciousness around the 40th second. That is good. That means he does not remember the final part. You step back from the table. The hands can finally come down. And only now, in this silence after, while the students exchange glances and someone begins to applaud, do you allow yourself to think not about technique, but about the man. He will survive, most likely, if the infection has not spread further, if fever does not set in, if his body can handle the shock. Too many ifs. That is the part of this work no one sees, the uncertainty that lives inside you after every operation. On the outside, you look composed. On the inside, you are counting the days until it becomes clear, saved or not. There is something the public does not understand about surgeons of your time. They think the hardest part is the patient's pain. It is not. The hardest part is the death you caused yourself. Not out of malice, not out of carelessness, out of ignorance. Because the medicine of 1846 does not yet know half of what will be known 50 years from now. You do not know about germs. No one does. Germ theory is coming. From Lister, from Semmelweis, from Pasteur, but not yet. Right now, you live in a world where surgeons operate in their street clothes. where instruments are wiped with a rag between procedures at best, where you can perform an autopsy in the morning and an operation in the afternoon, with the same hands washed in cold water. You are killing people. Not all of them, not intentionally, but some of the patients who survive the operating table die afterward, from the infection you brought with you, from the fever that in your time is called hospital disease and is considered almost inevitable. You do not know that you are the cause. That is the tragedy. Ignaz Semmelweis, a physician in Vienna, tried to prove this to his colleagues. He said, "Wash your hands, wash your instruments, and the death rate will fall." His data was irrefutable. His colleagues rejected his ideas. They laughed at him. He was eventually committed to a psychiatric institution where he died from the very infection he had spent his life warning others about. Medicine does not treat kindly those who are ahead of their time. You are a product of your time. You do everything correctly by the standards that exist. You are the best of the best under the rules that you know. And some of your patients die anyway. You learn to live with this, not to accept it, not to ignore it, to live with it, to carry it every day and still come back the next morning and pick up the scalpel again. Because the alternative, not picking it up, is worse. Because without you, everyone who could have survived will not. This is not heroism. This is arithmetic. And you stopped waiting for anyone to recognize that a long time ago. October 16th, 1846, Massachusetts General Hospital, Boston. You are not there, but the news reaches you quickly because this is the kind of news that changes everything. A dentist named William Morton proposes using ether as an anesthetic. Surgeon John Warren agrees to try. The patient, a young man with a tumor on his neck. Morton has him inhale ether vapor through a special glass globe. The patient loses consciousness. Warren makes the incision. The patient does not move. When he wakes up, the operation is finished. He says he felt nothing. Warren turns to the audience and says, "Gentlemen, this is no humbug. This is no humbug." 4 words that divided the history of medicine into before and after. When this news reaches you, you are sitting in your study late in the evening, reading the report, reading it again, and you do not know what to feel. Relief, of course. If this works, if it can be used widely, your patients will no longer remember pain. That is enormous. That changes everything. But there is something else, a strange feeling, almost an embarrassing one. Everything you spent years perfecting, the speed, the precision, the ability to work while a person screams and not let that screaming get under your skin, all of it is becoming less essential. Not unnecessary, but less critical. A surgeon no longer needs to be the fastest. He can be careful, methodical, thorough, because the patient is asleep and time is no longer the only mercy you can offer. You think of Robert Liston, of his 28 seconds, of the way people applauded his speed as though it were a heroic act. That world is ending.
And you, and everything you know how to do, are becoming part of something that is passing. You do not yet know what is ahead. Antiseptics, antibiotics, x-rays, anesthesia that can be precisely controlled. You do not know that medicine 100 years from now will look like something close to magic compared to what you do today. You only know one thing. Tomorrow morning the patients will come again, and you will walk into the operating room again. Because today, ether is not yet everywhere. Today you are still needed exactly as you are, fast, precise, capable of working through the screaming. Tomorrow, we will see. Here is what the history of medicine textbooks do not write about. They do not write about the fact that the best surgeons of that era were people who learned to do something impossible, to remain human on the inside and mechanical on the outside at the same time. Who heard the screaming and did not stop? Not because they were cruel, but because they understood. The only way to help is to not stop. They do not write about the fact that many of them drank heavily, regularly, not because they were weak, but because there was no other way to take off, at the end of the day, what had accumulated. The screams you cannot switch off. The faces of the patients you did not save. The arithmetic you run in your head. How many survived? How many did not? What you could have done differently. They do not write about the fact that many of them kept working through injuries of their own. Arthritis, back pain from hours of standing in one position. Because to stop meant leaving patients without the one person who could help them. You are one of them. You chose this life not because it is easy. You chose it because you could do something no one else could. And that ability, it is not a gift. It is years.
Thousands of hours of practice on cadavers in cold, anatomical theaters. The first operations when your hands shook. The mistakes you replayed alone afterward, again and again, until you understood exactly where it went wrong. Medicine remembers names: Liston, Morton, Lister, Semmelweis. It does not remember the thousands of nameless surgeons who walked into the operating room every day and did what needed to be done, who held the scalpel through the screaming, who counted seconds as a form of mercy, who went home and came back the next morning, again and again. You were one of them. And the world you knew, the world of speed and willpower as the only anesthesia, that world will disappear faster than you think. But while it exists, while it does, you are the best in it. And tomorrow they will scream again, and you will not stop.